If you enjoy this content, please take a moment to rate and review it. Your feedback will greatly impact our ability to reach more people. Thank you.
Hey man, we're back. How's it going?
Back. Happy New Year. It's going
Happy New
well.
Year.
Well, I feel like it's been a long time. We're used to sort of a cadence, and then with the holidays, we had a couple of weeks off.
It has been a long time, but I have to tell you, I really benefited from that break. I needed some sleep. I caught up on sleep. It's fast and furious out of the gate for the new year, but I am at least well rested. I'm in a new decade, turned 50.
Yeah, I know. Congratulations.
Thank you. It's a big deal to make that one. And I'm excited about the new year, man. I don't know. I feel like last year it was a bit of a slog to deliver the necessary things that we had in the business, but we got to the other side and we have some really exciting things queued up this year. And I also feel like we've got a really great handle on where the market is going, and so I'm pretty excited. I'm pretty excited about this year.
Yeah.
How about you?
Last year, this time, there was a lot of concern and a lot of excitement around what would Trump do, what's going to happen, all that stuff. Now I think we know. And, it certainly has been a lot of activity. There continues to be a lot of activity every day. But I think there are themes that we've covered on the show that, that he's likely to stick to. Whether you love the themes or hate them is a different matter. But I think I understand where he's headed.
Yes, I agree.
On the healthcare side, certainly on the healthcare side.
Yeah, but I think look, we're not going to talk about Venezuela on the show because there's not really a healthcare angle to it. But I think, you and I, we've been, we stay on X and we read a lot of the posts. And there were a lot of posts in the fourth quarter that were discussing the shift that the United States was making from a national security perspective, right? The shift in the posture towards China in particular, and the shift to sort of refocus on this hemisphere. And so, you could kind of see the nature of the commentary coming from the Pentagon, and all of the activity with the with the fishermen boats and things of that nature. And you could, I feel like it is still shocking to see it actually happen, but it's not like to me, it's not like they did not foreshadow that this was the direction they were moving in. I guess that's the only sort of objective analytical way I can sort of put it.
Yeah, I think that's right. And it is not, it's not the way that I would do it or that I think an American president should carry themselves, but I'm not in charge. I think Trump has been pretty consistent with his criticism towards NATO, the UN, really anyone who's going to impinge upon his absolute power, and he's consistent with that. And so I don't think it was that surprising. It's kind of shocking to have it actually happen, but that's how Trump is. And, whether I like it or don't like it, more people voted for him than Kamala.
Yeah, that's right. And now that we're in 2026, I think one of the things I've been reflecting on as we've been in this break is, we're done with the first quarter of the 21st century, and I think to some degree, we just got to kind of let the 20th century go.
Yeah.
That's right. It's over. Okay. It's over. And we've got to look forward. And I think everyone, my closest friends where we talk in a very unfiltered way about politics, right? You know what I mean? We'll talk about Project 2025, right? And there's a tracker and you can kind of look at all the things. And I just say to them, okay, well, what's your Project 2026? It's like that. The real question is what.
If you're a Democrat, what are you looking to the midterms or the?
Well, no, I'm talking about as individuals. I don't mean from a party perspective. I mean, what is your, how because I think that when you are trying to do business as normal, that's when this is just like a baseball bat to the head, you know what I mean? Over and over and over again. It's like, I can't believe. Well, you got to start believing,
Right. This is the world we're living in. It's been whether it is a simulation or not, it doesn't matter. It's where I'm going to wake up tomorrow, and this is the market reality that our business and this podcast and healthcare, we have plenty to do in healthcare, given the regulatory environment that we have under Kennedy and Trump right now. And that's what I'm going to focus on, because I think there's lots of opportunity. So
Yeah, yeah. I mean, I think there's lots of opportunity, and also I believe that we are very well positioned to make it a meaningful, positive impact in the lives of many Americans, and I hope over the course of the back half of this decade, many people around the world. Right? I mean, my hope is that we can take what we're doing at Jumpstart Health much more global over the course of the next 5 years, like maybe not that much in 2026, but I'm hoping, by 2030, the answer to that is yes. And we're going to have to navigate whoever is in office with whatever political agenda they have if we want to have that impact, right? I mean, I think that's just the reality.
And for Jumpstart, there'll be different countries, different regulatory apparatus, then we'll have to navigate.
100%.
And
100%.
I think healthcare is going to be really important no matter what geography you're in. And there's a lot of opportunity to make it better and to make money while you're doing it. So, yes.
Agreed. So with that, my friend, let's dig in. First story, head back to the economy, and we're starting off the year with a bang in terms of the Dow Jones market, 49,000 for the first time, a rally. The stock's gains move from the Magnificent Seven to names like SanDisk and Lockheed Martin. That's actually kind of a relief to see some new names driving the rally. But what do you think about starting off the year like this?
Yeah, I mean, I think that we're going to continue to see this. I mean, the valuations are untethered from history, kind of like you're saying. I mean, we cannot use like our expectations from the past 50 years to judge where we are today. I think that the U.S. economy is really the best place in the world to invest, and the Dow is some of the best companies in the U.S. economy. I'm seeing AI filter into all kinds of companies from a use case point of view. The Mag 7 certainly will continue to benefit, but I think it's going to spread around. And we're going to continue to see records, in my opinion. Now, it's not going to be a straight line up, but I think we're going to have records, continuously.
Yeah, it doesn't really appear to be anything that's stopping it. And several of the podcasts that I've been listening to over the break leading into the new year have sort of just admitted that where we are now, the American economy is Wall Street, right? Which is a little bit counter to the messaging that we heard coming out of the White House, and most specifically from Treasury. Scott Bessent said, okay, Wall Street's had their turn. Now it's time for Main Street. But we don't really see that reflected in the market results, right? And I don't know that we see that reflected in job results or household earning results either. It seems to me it's more of the same. And I think when we look at, Trump's economic results from last year, redomestication of manufacturing, lots of, huge investments from corporations, mergers, and sort of like, state sanctioned deals and things of that nature. I didn't hear anything that was that beneficial for Main Street. I really didn't. You know what I mean? The things that I saw were all directed at Wall Street. And so I just think it's nothing stops this train until there's a meaningful change in policy. And I don't see that coming.
Yeah, so I agree with that. And I think that I agree with everything you said, except that go back to the American economy is equal to Wall Street. I don't know if I agree with that. I mean, people are still, it's something like over half of Americans don't own stock at all. So there's a lot of people out there that are not benefiting from this. I wish they were, but I don't think it's going to, it might sort of filter down to everyone over several years, but I don't have a lot of confidence that's going to happen.
Yeah. So I think maybe I'll say spiritually, I agree with you, and at the same time, I think factually, I think this is what it is, and I think that was my point about Wall Street versus Main Street, which is the middle class is becoming a less and less meaningful part of the American economy, right? And that carries its own social fabric issues with it, right? It's like that. There's nothing good about that message. There's nothing good about me saying the American economy is actually Wall Street and not Main Street. But I just don't see any indications to the contrary. Right. I mean, I think just today, Trump put this post out on Truth Social that said he's going to start working on stopping corporations from buying houses. And, okay, that seems like, maybe a little too late. I mean, I don't know how much BlackRock has already bought up. Maybe they're done buying houses at this point. You know what I mean?
Yeah, they're selling houses now, so it probably is okay. Yeah.
Right. Exactly. So yeah, I mean, I guess my point is really the same as yours. And I agree with you in spirit, but I think in practice and in reality, unfortunately, the only meaningful segment of the American economy is in fact, especially like we don't even know what the reality of jobs numbers is. And our next story is about jobs, right? On CNN, the number of available jobs in the U.S. jumps to its lowest level in more than a year. But again, we spent the last half of last year saying, hey, the BLS numbers, we don't even know if we can trust them at the moment.
Yeah, that's right. I mean, I think that is right in general. And at the same time, there are swaths of healthcare. I mean, there's nurses, there's medtech. In healthcare particularly, there are a lot of workers that one of the areas where jobs are growing is in the healthcare space. It's really one of the only spaces that's working. So I think there is hope for people in middle class or lower class moving up and building a life for themselves without having to own stocks. But I agree, it's being challenged. So maybe I'm being too Pollyannish about it. I don't know.
No, I don't think you are. I mean, I think you are you're pointing to the fact that it's very unhealthy for the American economy to only be Wall Street, right? And I fully agree with that. I fully agree with that. But I think one of the scariest things about the K is, I don't know, how did you feel? Like, think about where you were the beginning of last year and the beginning of this year. So here's kind of a general feeling that I carry with me right now is, because you and I talk about Health Further, every week, and all the stuff that we cover, because we're on X, because we play with Claude Code, because we do the things we do. I feel like I have less related content to discuss with the average American today than I did a year ago. I feel like the world is bifurcating to where, like, okay, I'm tracking the top part of the K pretty closely, because this is what you and we're venture capitalists. There's no way we can say we're not like part of that wave. Right. We're not tip of the spear by any means, but like we're getting dragged into that current, right?
Mm-hmm. Yeah. Right. I think that's right, and it is getting further and further distant between the haves and the have-nots. And at the same time, the availability of information and education and people being able to learn how to use Claude Code, you can go on YouTube. I mean, I have access to being able to pay for things, and I'm using YouTube because that's where the up-to-date, most relevant content is. And so it's partially it is kind of your intention and how much you're willing to put into learning these things. And partially it is sort of, I have privilege and an ability to do that. I have time to do that, where I don't have a job that I am exhausted when I come home and can't focus on it. So I don't know, it's like 50-50. There's lots of opportunity to pull yourself up, but it's getting harder and harder to break into the middle class.
I couldn't agree more. And you make a really good point about the fact that all the information is free on YouTube and X. It's like my group chats that I just spam with all this information. I'm not paying for it. It's just,
Yeah.
it's just on my X
You're
account and on
seeing it,
YouTube.
or you're curating, you're looking at enough things that you can see the 5% that are really valuable. You have to look at a lot of stuff in order to find the value there, but it's there.
Yeah. Yeah, so let's just quickly quote some of these numbers here. So the number of estimated job openings, a closely watched indicator of labor demand, fell to its lowest level in more than a year, slumping to 7.15 million at the end of November from 7.45 million the month before, according to the latest job openings and labor turnover study from the Bureau of Labor Statistics. I mean, that tracks for me. My friends who work in large corporations, especially if they work anywhere close to recruiting, have been, ringing the alarm bells with me for a while and saying that 2026 is going to be more of the same, and maybe even more aggressively and more shocking in terms of the kind of job cuts that are on the way. And so nothing surprising, but also not very encouraging, when we think about, okay, what does the middle class do in a time like this?
Yeah, that's right. And I think it's going to get worse until there is some kind of social upheaval, unfortunately.
Yeah, unfortunately. Let's move to VC. So no real deals of note, but you pulled out this story about Antler. This is a firm that has set out to really sort of, I don't want to say disrupt, but I would say maybe be on the bleeding edge of how AI is going to transform venture capital. And so we've been at least tracking them from a news perspective and thinking, on our own about how AI is going to transform our business here at Jumpstart Health. But this is a great headline from them. Venture firm Antler made over 400 investments last year and just reloaded with 160 million. So they're a global firm. They focus on early stage AI inflected startups. And this year they're aiming for 500 investments. So kind of taking the old 500 startups, target and aiming to get that done in 1 year.
Yeah, that's right. And what I was really almost shocked about is the 45 general partners that they claim to have. I think it is difficult to keep that many GPs coordinated and working in the same direction. I think it's hard to keep 5 general partners working in the same direction, never mind 45 across every time zone I think they're across the globe. So they are using communication technology, AI, in a way that is certainly changing the VC business model, I think for the better. We'll see. But it's also much further than we are doing right now. I mean, we are virtual, but we have 3 general partners. Now we might add one more. So we might add 1 or 2, but I don't expect us to get to 40. And it seems like really high.
Yeah, so I mean, I think it's worth just quickly discussing the differences in VC strategies, right? So you have a school of thought in VC. And I think most people adhere to this, but probably on a spectrum around the nature of the power law and how you really just cannot beat the power law. And so, some venture capitalists sort of have run the numbers and they have come up with the theory, especially if they're generalists. And I believe that Antler is a generalist firm. They do healthcare, but I think they do more than healthcare, right? And so I think what I have seen generalists who really, really pray at the altar of power law believe is it's really about shots on goal, because they just don't believe there's much you're going to do as a VC to value add to the business. And then, maybe on the other side of the spectrum, you've got your venture studios, right? You know what I mean? Where they're literally building the company in-house and then work with VCs to get it funded and get it built. I'd say we are somewhere in between, those 2 poles. But I think, the further you are from worshiping at the altar of power law, the more you believe in the importance of the GP and of alignment of GPs, right? Whereas I think if you just believe it's all power law and it's just like get the deals done, I don't know how much alignment you even need, right? It's really just like how fast can you get the deals done? Can you get access? Can you move? Can you just build the portfolio? And it feels like that's really the model that Antler's going for here.
Yeah, I think that's right. And it's a sign of kind of where the industry is going that we need to keep watching. but I like our strategy, of course.
Of course.
Yeah, so I don't know. It's good to watch them and pay attention to them.
Yeah, for sure. I mean, look, VC's a long game in their early stage, so really we're not going to know for 5 years at the earliest, right? That's the kind of time it's going to take.
I think 500 showed that if you invest in so many things that you effectively have an index of the VC market, that does not work. That's what 500 taught me. That was 20 years ago, and this firm is doing not the same thing, but it rhymes with it, or it's similar to it.
Yeah, it rhymes with it. Okay, moving into policy. So HRSA endorses at-home screening recommendation for cervical cancer. So HRSA is the Health Resources and Services Administration, and I have always thought about HRSA as sort of an outpost agency under HHS, but really more tightly coupled with the White House. And that could be just because the origins were sort of spun out of a White House initiative. But HRSA's focus is really on, the underserved, kind of the Medicaid population, the rural population, mothers and children, American Indians and Alaskan Natives, right? I mean, that's really what HRSA focuses on. And so to me, this headline was striking when you had it in the stack of articles for today, because normally when we talk about things like at-home screening, we're talking about top of the K, right? It's rare that we're talking about bottom of the K. And this is, to me, it's like the first real push coming out of DC, where we're starting to see this MAHA strategy of distributing healthcare out to the edges now being focused on rural populations, the underserved, in a really meaningful way.
Yeah, I agree. And I think that it is really interesting. And I agree it's a new approach from the administration, and I think really positive. There are lots of people that they're working in a full-time job, maybe they have a couple of jobs. They can't get to the doctor to get their screenings done. And it doesn't mean they don't care about their health. They're busy, and they're running around, and it's taking off a full day of work to go do that. It's just not realistic, or they don't choose to do it in the numbers that would be best for population health. And at the same time, I think we now have technology that can deliver the same quality screening results with an at-home test that is self-administered and then put in the mail and shipped to a collection site where they do the actual lab work there. I think it should be available for everyone. It's not only valuable for wealthy people, and we don't have enough women that are screened for cervical cancer.
That's right.
And so I can't quote the amounts, but I think this is a great thing. What I was pleasantly surprised about is that not only are they sort of approving it, but they're requiring that it says most payers will be required to start covering this with no cost sharing starting next January, a year from now. And I think that's great. I'm not sure payers will love it, but I think it's great.
Yeah, and look, I mean, this is near and dear to my heart. I've lost dear women in my life to cancers that are specific to female anatomy, and the diagnosis is the difference. The diagnosis is the difference. It's all in the screening. I just had a dear friend who was just diagnosed with with breast cancer at the end of the year. It was like sort of her New Year's news. And for me, it is anything we can do to make this screening more available. It just changes everything. It's like it's lives, it's families, and I too, Vic, I'm really, really encouraged by this initiative. So, credit to HRSA on this. Now moving to the CDC. So
maybe less encouraging.
Well, look, I mean, I'm gonna not sort of opine. I'm gonna probably just focus on what has happened here. Yeah, the facts, ma'am. The CDC pairs the list of recommended childhood vaccines. The changes would bring the U.S. closer to Denmark's schedule and end universal recommendations for COVID-19 and flu shots, among others. This has been in the works from day one, right? I think yes. When we were covering the onboarding of RFK Jr., the very first thing he did was wiped out, the Council of Vaccine Advisory, right, for HHS, and so
I think a lot of people voted for him and then voted for Trump and him for this particular issue. Yes. So I mean, now that it's done, it's done. I mean, what now? Now pediatricians will be working with the parents to come to a joint decision making about what their children should receive as far as vaccines. I think that's the policy.
Yeah, which means those decisions will be all over the map.
Yes. And it gives the impression, and whether this is good or bad is not factual. But it gives the impression that there's a lot of choice, and there are good parents that would decide one way or the other. Mm-hmm. And I agree we shouldn't opine on whether that's good or bad, but that's what's going to happen. Is pediatricians will spend more time educating parents.
Mm-hmm. Yes,
which maybe is good as long as they take the time. No. I'm not sure they have the time to do it. And then there'll be some decisions that are not like they used to be.
So I'm glad I asked you, like, what next, because you just got to a very practical what's next thing, right? Without us talking about, oh, this is horrible. No. Here's something very practical. Pediatricians will have to take more time in discussing this matter, right?
And they're not going to be compensated for that.
No, they already have huge panels.
It's going to be a clinic visit. They get paid for 7 minutes or 10 minutes, and they cannot cover all the things they need to cover in that time. And they're going to have to choose, do I not talk about this at all, or do I cut something else that is valuable to talk about in that time? Or do I talk for 30 minutes, but now I'm getting paid for 7 minutes and I'm talking for 10 minutes, for 30 minutes?
Right. And then here's maybe one more thing, and then let's move to the next story. Now that it becomes a choice, do we start having left-leaning and or right-leaning doctors, basically, right? Where it's like now the panel reflects the ideology of the doctor, and which just sort of is less cohesion. Like we continue to divide, in all the different ways. And now do our doctors' offices become more divided as well?
Maybe. I think that doctors are going to not chase patients away over this issue, but that could be wrong. I don't know.
Moving to our next story.
We could do an entire story on that, and entire show on that one story. So
we really could.
We can move on.
So Utah is a very, very innovative state. Our good friends at Celtic Bank have taught us a lot about the great state of Utah. And one thing we've learned is just that they're a very forward adopting state when it comes to technology. Utah's probably like the first place I went to where they had the digital ID. They've got digital driver's licenses there. So they're very sort of advanced in terms of adopting technology for the benefit of their citizenry, right? To make things more convenient, easier, and all those types of things. So Utah, and this is a post from X, at Andrew Curran _ Utah has become the first state to allow AI to renew medical prescriptions with no doctor involved. The company, Doctronic, also secured a malpractice insurance policy for their AI. Their data also shows that their system matches doctor treatment plans 99.2% of the time. So, I think last year we were talking about like what's going to happen with malpractice, what's going to happen here, what's going to happen there. And one of the interesting things about Utah is they just kind of figure out a way to like get things live. You know what I mean? Like they don't sit there with those problems and questions forever. They just are like, hey, we're just going to like do this. And I think this is a really big breakthrough right now. One thing I think we both know from our time in Utah is that everything that happens in Utah does not necessarily proliferate to the rest of the United States. And so there's no guarantee that this is the beginning of a fire that's just going to kind of move around the country, but it's a pretty big breakthrough, don't you think?
Yeah, I think it's a huge break, and I think it should proliferate. I don't know if I agree. I'm not sure it will, but the renewal of prescriptions is a very good place to do this, to bring AI in. I think what that means is you already have been prescribed a medication, and you get 2 refills, 3 refills as part of the initial prescription. And then there needs to be an assessment of should this medication continue, but it's a pretty straightforward analysis of what is being treated, what is the medication, how has it been so far. I think it's a great use case for this.
I do too. I think it's a very, very smart use case with, generally speaking, pretty low risk, and I like that they're citing a 99.2%, matching rate. That's fantastic. Not something for the pod, but just something of interest is like, the malpractice insurance policy. I would love to know how that process was worked out, and I would love to know what they're paying, for that policy, because it's like, you think about those policies and they are a pain in the neck, but on top of that, you're also paying for the doctor, right? Which is a very, very expensive human resource. And in this case, okay, yes, you've got a very serious malpractice insurance policy, but you ain't got no doc, right? You just got tokens and GPUs. And so the math in this model could end up really, really serving as a template that over the next 5 years, we see lots of other companies try to stamp out and apply to other, what's the next safest area to apply this kind of model to, right?
Yeah, that's right. And I think that's the question in my mind is like, I think the truth is that when I call my cardiologist to get my statin renewed, it's a pretty formulaic process. There's not a lot of complicated human judgment that goes into that. And so it's an easy place to go. And then I agree with you. There are multiple other areas that are not added value for the physician. In fact, they're a drag. I mean, it's like, they're not compensated for that. They have to do it. Maybe they get a small reimbursement, but it's not why any doc went into practice medicine to renew the prescription. Now, if something changes, certainly you need to think about it. But I think there's a lot of parts of healthcare that are in that kind of gray area that traditionally physicians have been the decision point because we had no other resource. But if we looked at it carefully, there's opportunity where it's not the ideal, not the highest and best use of their time, and it can be done very reliably with artificial intelligence. And the insurance policy is the gating factor, as you point out. That's right. That's the interesting part of this story, and why I think will proliferate. Maybe not around the entire country, but there'll be follow up and new things, which is positive.
Yep, agree. Okay, the health department freezes $10 billion in funding to 5 Democratic states. So, I mean, look, the tension between DC, the White House, and the Democratic states is truly at an all-time high. That is sort of to be expected because we're now in our midterm year, and so there's a lot on the line politically, right? But man, it just makes me wonder, like, when I was younger, did I just miss the memo on when this other stuff was happening, and now I'm old enough to like actually pay attention, or is this really out of the norm, right? Is this truly out of the norm to withhold funding in this way for political reasons? And I don't know, right? I mean, this is the kind of thing where I look back and people will show you, well, hey, back then this happened or this happened. So I don't want to say like this is totally breaking the norms, but gosh, it's just not what you want to see, right? Because who cares? These are American citizens who live in these 5 democratic states, and you don't want to see federal funds being held back from those American citizens who need them. So.
Yeah, I agree with that completely. I think it is. I don't have the facts. I'm 5 years older than you, but not old enough that I can remember the 70s and 80s. There was certainly a lot of political fighting, but I don't recall and I don't believe there was this kind of action. Even though there was fights back and forth, I agree with you. At the end of the day, we're all Americans, and people would not, whatever political party you're in, wouldn't hold money back from servicing other Americans. So I agree with that. I also would say that the fraud stories have to get cleaned up. I mean, there's a honest debate about where should we rely on government services and where should the free market or less regulation, that would be healthy. We have to try to stop the fraud so we can get away from that, and then have the debate about like how should we take care of our population, because the fraud just confuses everything, and it gives this, like, I don't know, it's like a free pass to hold the money back because you can just claim there's fraud everywhere, where of course there's not fraud everywhere in these states, but that's the issue, I think.
Yeah. So, okay. And I think you have, you start really losing any moral high ground when you start saying, never mind the fraud, right? Now, having said that, I am a little bit struggling with a $10 billion action coming out of DC, largely triggered by citizen journalism from a kid younger than my son.
Right.
You know what I mean? Like,
yeah.
I'm just not entirely sure that's the burden of proof required to cut back $10 billion across 5 states. And I didn't even know who this kid was, man. Like, can I tell you the first time
who he was? I didn't know who he was. I mean,
I had no idea who he was. The very first time I saw him, I was on Farcaster, the now almost defunct social network on crypto, and Coinbase is kind of taking it over with Base, and so they're like recruiting people to be on there. They want creators on the platform, blah blah blah. And it was like, hey, it's me, the real Nick Shirley, here on Base to tell everybody. And I was like, I have no idea who the real Nick Shirley is. You know what I mean? I was just like, who is Nick Shirley?
Nick Shirley's? I mean,
right.
Only one Nick Shirley.
Yeah. So I was like, I don't even know who this guy is, And then like it was a couple days later, because I didn't even think anything of it. I just thought it's one of these young influencer kids that is doing something that's. I'm 50 now, right? I shouldn't know who they are. But turns out, no, this one I need to know who he is, right? Because he's not a regular influencer kid. He's doing some pretty in-depth, citizen journalism that is having serious implications, right? And so, yeah, I mean, listen, obviously anyone who's following the story knows that there have been counter stories. CBS came out with, with a counter story saying, hey, there were actually people and kids in that, but to me, it seems pretty clear that the halting of the $10 billion is not solely fraud related and has some, some political animus underneath it. And it just feels to me like we've gotten to a place in America where the stakes are high and we're willing to play with just very high stakes poker for political reasons now. You know what I mean? And I don't know.
Yeah. I agree. I mean, I think both things, in my opinion, both things are true. Both things certainly can be true. No one should accept our money being spent fraudulently and enriching people that are not doing the thing. That we don't have enough money to take care of children in our country, and we shouldn't waste it. I think that's obvious and is true. And I think it's also true that the Republicans in this case, but I don't think the Democrats are above it. I think politicians are apt to take one issue and blow it up and maybe several $100 million. It says here $185 million, not $10 billion was fraudulent. And then the Republicans in this case have frozen $10 billion in multiple states because of this, say it's $200 million fraud. And so I think both things are true. And to me, it's sad that both are true. And I agree. I wish neither were true.
Yeah. Yeah. The FDA paves the way for more consumer wearables, AI-enabled devices to hit the market. So it is CES week, and so all sorts of things are happening. I think this is our first story that is coming out of CES. FDA Commissioner Marty McCary was there. And basically, I think you and I are fans of Marty insofar as like he seems like a pretty reasonable guy, pretty thoughtful guy, and we want him to be successful. And the FDA does need to modernize its entire platform for this new era of wearables as medical devices and artificial intelligence. It's like it has to modernize itself. And it seems like this is a really meaningful step because we ended last year wondering like, hey, what's going to go on with Whoop and the FDA and some of these other, consumer or prosumer grade wearables. But now we have a new category for these non-invasive devices where they have sort of a green light to start collecting and analyzing physiological data in a way that's going to be helpful for healthcare purposes. And that's, to me, it just seems like we're far enough into this thing now. The Apple Watch is on, I think, Series 11. Oura Ring, I think, is on Series 6. Whoop has been around for a while. We had Fitbit before almost any of this stuff. It's like we're not 2 or 3 years in. This technology is pretty mature at this point.
Yeah, no question. And to me, there are a lot of products, you've named several, but there's others that are primarily consumer products. Right? And I use one. You use one. A lot of people that listen to us use a device to educate themselves about their own biologics, their own healthcare status, how much they slept, what their heart rate is, what all these different things. But they're not physicians, and they're not using it to diagnose other people. And so to me, that's a pretty clear line that I think is how they're defining this general wellness device versus clinical decision support software. Is that, if you are using a heart rate tool for your own monitoring or a sleep tool or something, that there is sort of a level of assurity that FDA can do is make sure it's reasonably accurate, but it's much lower than what we would need for a clinical decision support software. It's actually a tool that physicians use to render a diagnosis. And that makes a lot of sense to me. And I think I agree. Marty is doing a good job trying to navigate this in a way that makes a lot of sense.
Yeah, and also like this to me feels like it's in line with the Maha strategy, right? And I just always worry about Marty because it feels like he's a little bit out there on an island, like as a it's like a real doctor, you know what I mean? And so it's good to see him be able to deliver something that I think is going to be welcomed by the general public, but also should keep him in the good graces with RFK Jr. and everything that Maha's moving forward on. Okay, the 340B rebate pilot put on hold in temporary win for hospitals. So, it feels like all of last year was a scary time for hospitals, especially safety net nonprofit hospitals when it came to the 340B program. This rebate pilot would have changed the cash flow model because instead of just being able to buy at a discount, you would have had to buy at full price and then basically go into a rebate/reimbursement business model. And that's just not how they're designed. They sort of have this business model designed to be lower cost, and then they make money on the spread. And so it looks like in Maine they were able to get it paused. I kind of feel like this thing is so important to this industry, and they're going to just fight at every level, and especially the American Hospital Association is just going to like fight this tooth and nail with every dollar they have. That it feels to me it's probably going to go to the Supreme Court, Vic.
Yeah, it's a big topic with lots of money and many strong opinions on both sides. So I think I don't know the legal precedent and how it's flowing, but I think it has that sort of gravitas that it's likely going to go to the Supreme Court. I agree.
I mean, the stakes are just too high for them to just give up on it, right? I mean, the margins are already too thin. We all know what's coming kind of 2027 and beyond as a result of, the one big beautiful bill. Right. They got to try to keep this program in place.
Yeah, I agree. Whether they have a legal case or not, I don't fully understand, but I agree that it is it's a huge issue that they're going to fight as far as they can.
Yeah, we don't have a dog in the hunt. We're not part of a hospital. I'm just sort of objectively saying I just don't think, given all the other financial pressures that they're facing, that they can allow this to go without the fight of their lives. It just feels too important, for safety net hospitals and for broadly nonprofit hospitals. So okay, UnitedHealthcare raises the bar for doctors to get paid for radiology services. So it's interesting. Obviously, there's a lot of focus on UnitedHealthcare as after sort of everything over the last 2 years. It's crazy. We're now in January of 2026, and Change Healthcare was that what was that February of 2024?
I think that was 2024, and then Brian whatever was murdered in the end of 2024. Wasn't that?
Yeah.
It all happened in 2024. The cyber attack was early 2024, and then what's Brian's last name?
Thompson. Brian Thompson.
Thompson got murdered in December, maybe December.
Yeah. So
hard year.
So we're now 2 years out from the Change Healthcare moment, right? And it just feels like the stories that we see about UnitedHealthcare are just pointing out areas where they're standing out from the rest of the pack, especially as it relates to how they are treating providers, right? And so, this story is about raising the bar on what it's going to take for radiology docs to get paid. And, you read this article from Healthcare Dive, and it sounds like it's just going to be a lot more paperwork in order for the rad docs work to not just get bundled in with basic evaluation for the, and management for the visit. And so it's just sort of a really interesting thing how brand and brand positioning can sort of color all the stories that end up coming out, because UnitedHealthcare is like a huge company. There's like a million different stories that could be coming out about them at any given point in time, right? But these are the stories that we're going to see now, right?
Yeah, I interpreted it a little bit differently, but I agree that UnitedHealthcare is under the microscope, certainly. The way I interpreted this is that often, and I think it is appropriate a lot of times, often a radiologist will read the image and then they, of course, send their results to the primary care doc or maybe a cardiologist or a surgeon or someone else. That physician does their own, it's called evaluation and management, E&M work on the image and the report. They take their own judgment, use it in sort of combination with the rest of the medical record, and they've been seeing the patient or whatever, and then they also bill for that time. And I think what United is saying is that you cannot bill twice for the same radiology interpretation. So like if the radiologist is billing, then the primary care doc can also bill for the evaluation of that report. And I understand that from the payer's point of view, but there is a difference, I think, too. So I think it's a debate that should be had, but that's how I interpreted it. It's
Yeah, I mean,
well over my head as far as actually what's right, but that's how I.
Yeah, and I guess what you just said is exactly kind of my point, right? Because when you read the headline and then the subheadline, so the headline was UnitedHealthcare raises bar for doctors to get paid for radiology services. And then the subline is the change runs counter to the company's broader efforts to pare back red tape for physicians amid widespread discontent with health insurers. Like, so, and it's not that it's not true that there's not widespread discontent with health insurers, right? But as you get into the meat of the article, you're almost like, how important is this change? You know, or are people just scouring the UnitedHealthcare sort of, changes that get rolled out and saying, oh, there's one that's gonna fly as a story. It's just something I'm starting to wonder about.
I think it is true that United is under the microscope, and I think it's also true that payers are being forced to really cut back on what they approve because of their own business model challenges. And so, I think it's true that United is changing their policy, somewhat, but it's being spun definitely more negative than maybe it needs to be.
Yeah, I mean, I don't see the equal number or even outside of quarterly earnings. I really don't see any stories talking about the difficulties that payers are encountering with MLR over the last 12 months, right? You know what I mean? Yeah. So I think that's kind of my point.
Yeah, payers in general have always been the bad cop in the process.
Yes.
And whether that's right or not right, that's just how they've always sort of been framed for decades.
Strike notice rescinded at some New York hospitals, but 16,700 nurses still eye Jan 12th strike. So it looks like this one's going to get resolved. It seems like there was a lot of good progress with the New York State Nurses Association from a January 7th update. But they do still reserve the right to strike on the 12th. And there's, almost 17,000 nurses who are set to do that if I think a short list of other demands don't get resolved between now and then.
Yeah, and this sort of bubbles up every 6 to 9 months. There's a story. It does seem like the threat of a strike, or sometimes it's a one-day actual strike, ends up they get to some resolution. So hopefully they will before the strike. But I agree. Hopefully there's progress being made.
Yeah. New Jersey healthcare giant poised to acquire another hospital, RWJ Barnabas Health, has signed a definitive agreement with Englewood Health that would absorb Englewood, which operates one of the last independent hospitals in the state, into the larger system. So it's actually a pretty small deal, but I guess it's meaningful insofar as Hackensack Meridian tried to purchase Englewood Health previously and was unable to do so. I guess it was blocked. But RWJ Barnabas is apparently going to be able to get this one through.
I think it's because of the Trump administration versus the Biden administration. But yes, we don't know that it will get through, but they are going forward thinking it's going to. It's a small system, as you said, but there's really only 2 significant platforms in New Jersey. So there is a question about, what is best for the consumers. I mean, I don't know. It should be part of one of them. So I don't know. I mean, it's sort of 6 to 1 out of the other.
Okay, moving into pharma. Novo Nordisk's Wegovy pill is now broadly available in the U.S. So I think this is Novo Nordisk's big hope, kind of entering the year with their pill for their GLP-1 and hoping that it really turns around things for the stock. Any early indicators? I mean, the stock is up, slightly, which is better than being down. But it seems like they've had so many challenges that they've had to overcome, and Eli Lilly has really flanked them at every corner. So what's your read of how this is going so far? It's very early at the moment.
Yeah, I haven't seen any prescription data or kind of adoption data. As we have talked about before, I think a pill will be far more popular over time. Whether they come out of the gates like really quickly or not, it's hard to say. I don't know.
AbbVie nears a deal for Revolution Medicines. The cancer drug biotech shares jumped 30% Wednesday afternoon. And actually, AbbVie also got a bump, about 5%. So this has obviously been very, very well received by Wall Street. AbbVie's been a really great pharma brand. We don't talk a whole lot about them, but they're behind Botox and Humira, and they've just really kind of quietly been killing it over in the corner. And I think they've proven to be a very, very effective commercialization partner. And it sounds like getting into the cancer business with Revolution is something Wall Street's pretty excited about.
Yeah, this technology code RAS, in some way it's like part of the cancer metabolic function, I think, is what they're inhibiting. And it's, I think, really helpful in lung cancer and pancreatic cancer. I don't really know the science behind it, but it's very, stock market thinks it's really good. So, pancreatic cancer, we need solutions for. We need for all cancer, really.
Another biotech deal, Eli Lilly nears a deal for biotech Ventyx. It's roughly $1 billion. It could happen any day now. They're in talks to acquire Ventyx Biosciences. And this is really in the autoimmune space. They are developing pills that can treat inflammatory diseases. And the deal could come as soon as, this week.
I mean, inflammation is, it's almost core to half of it. A lot of diseases are made worse or triggered by inflammation. So yes, it's a huge opportunity. The deal's not finished yet, but it seems like it's about to happen.
Yeah, Crohn's, rheumatoid arthritis. It's a pretty broad population out there suffering from these inflammation-related autoimmune diseases. And so, it's exciting. And then another Eli Lilly story. They are working with a drug discovery company that is AI-enabled called Nimbus on an oral obesity treatment. And so this is them working on their pill. And Nimbus apparently has lined up some really nice upfront and near-term milestone payments totaling about $55 million. So this is the first name-worthy sort of AI drug discovery company that I've heard of where I'm seeing what the numbers look like, right? We've heard a lot about them. We've heard about how AI is going to really transform the way that drug discovery works. And it sounds like Nimbus is a company we ought to pay more attention to as their initial engagement with Eli Lilly around the GLP-1 pill could total $55 million.
Yeah, that's right. I think that it's really promising. And I think they are several steps behind Novo. So we'll see. But yeah, it's their answer to that.
All right. Moving into our AI rundown, just 5 stories left. Introducing ChatGPT Health. So OpenAI, we've been covering the importance of healthcare to ChatGPT, to OpenAI for a year now. And now the numbers are starting to roll out. ChatGPT, 5%, more than 5% of all conversations that are happening on the platform are healthcare related conversations. And now they have sort of taken that use case that is so significant and actually they've productized it. So now if you look in the left of your ChatGPT account, you're going to see a health tab. You click on that tab and now you can start to integrate Apple Health, your health records, MyFitnessPal, and other things, pulling in all that data to get more personalized recommendations.
Yeah, that's right. And there's a wait list, so it's not available to everyone right now. They rolled it out today, I think, maybe yesterday. But I expect the wait list will go fairly quickly because they want to get more people on. I am on record multiple times saying I don't fully trust OpenAI, and I would not put my own health data in there. They say they will delete all the data every 30 days. But the takeaway for me is everyone else, including our portfolio companies and our listeners, we don't have time to wait. I mean, OpenAI is going full steam into healthcare, whether they have appropriate guardrails or not, really is not topic for discussion. They're just going, all gas, no brake. And as the next story we'll talk about, healthcare is a really valuable component of what their users want to talk about. And so they are smart to productize it, even though I wouldn't personally use it.
Yes, ditto, plus 100 to everything you just said. So I don't, moving to the next story, which is Fierce Healthcare. 40 million people use ChatGPT to get answers to healthcare questions every day. Every day, and to me, Vic, I do think there is something important in what you said about the trust, right? Because OpenAI's greatest asset is really their brand and their first mover advantage, right? They did get out of the gates with a sufficient enough lead where ChatGPT really is the default AI product that most people use. And the proof is in the pudding here. 40 million people a day are using ChatGPT to answer healthcare questions, right? I mean, that's a really meaningful number. And I think that we're just going to have to see how this changes the healthcare system, because at that number, it's going to change the behavior of the general public, right? In a statistically meaningful way that the healthcare industry will have to adjust to. Right. And even if it's not adjusted to at a policy level, it will be adjusted to in a day-to-day experience level. It probably already is significantly, right? If 40 million people are already doing it every day, then doctors are having to deal with it every single day. And I think maybe the younger ones will really appreciate it, know how to integrate it, know how to talk about it. Maybe some of the older ones are like, totally frustrated and running for the hills faster because of it. But in some way, shape, or form, when you got 40 million people a day engaging with the system, it's making an impact in the system today.
Yes, no question. And I think, the way that I look at this is what it means is there's an opportunity for healthcare brands, healthcare companies, healthcare startups, healthcare providers, healthcare VCs, podcasts talking about healthcare, to provide more information and help these 40 million people navigate the healthcare system. It is too complicated. We don't do a good job explaining what a diagnosis means, what to expect, how to approach it. And so there's an opportunity. OpenAI is running into it, but there's an opportunity for others who I would argue might do it better if they could get out of their own way and be clear and honest and answer people's questions to fill this demand. There's clearly a big demand for more healthcare information presented in a way that you can understand and ask follow-up questions, and the person explaining or the entity, the technology explaining, doesn't get frustrated and say, I gotta go do the next visit. And so it's really the reimbursement structure, the incentive structure. There's an opportunity for our industry, our portfolio company, to begin to fill this gap. And if we don't, OpenAI is certainly going to.
Listen, 100%. I think this general purpose healthcare communication capability, that game is won, right? I think we have to admit that the frontier models, and whether it's OpenAI or Claude or Gemini or Copilot or it really doesn't matter. The frontier models will handle the large general use cases, and no startup's you're just not gonna do it, right? It's really about how can you really nail a niche, right, for an audience that needs something more than what this can offer. And I don't know if it's always even going to be the patient population. I think so much of the stuff, Vic, we're going to be focused on delivering is going to be more kind of within the industry where there actually are greater regulatory requirements, right? Because that's where I think we can create more specific solutions to meet use cases that ChatGPT just won't prioritize for, right? It's just like, why would we do that? We have 40 million people a day and growing, on this platform. So I still think, in a $3-4 trillion industry, there's plenty of opportunity for everybody. But yes, we have to acknowledge these types of things and understand that in a very short period of time, the game has changed.
Yeah, and it's no longer possible to say you can't get that information unless you go see your doctor. That's not real. I mean, 40 million people today are talking to an AI about it.
100%. 100%. Okay, I'm gonna let you talk about the story because I think it's a smart one, but you've read it and I haven't. So this is Wall Street Journal. The headline is "Hospitals are a proving ground for what AI can do and what it can't." And I think this even kind of speaks to the point, the point we were just making about what the opportunity really is for our portfolio companies.
Yeah, that's right. So AI is very powerful, and it also is certainly willing to fill in the gaps if it doesn't have access to the data very quickly, which we would call hallucination at times. But it really is just a great article in that they lead with a positive use case. It's a radiologist who has halved the time it takes him to do a full report using the technology. So he used to take him 75 seconds to do an X-ray report. Seems fast to me. But now he can do it in 45 seconds. And he says in the article that he has a queue of images to be read that he never gets to the end of. So like the fact that he can speed up means twice as many patients are getting their answer, and it's being answered faster. And to your point about diagnosis, getting the diagnosis even a week faster can really make a big difference. So there are great aspects of using AI. And the article led with that. And then the next part, it talks about there's downsides to it. And a lot of doctors have explored the idea that for complex cases, and they give a Mayo Clinic doctor talking about a complicated heart procedure with the patient had other situations going on, and he put all the information into ChatGPT to see if you could get references to other patients, other cases, academic studies, as a way to quickly, get some help for this. He's at Mayo, but, he's doing a lot, and he didn't want to go into the academic literature. And it showed several places where it had been safe and effective in published reports, which seemed very promising. But then when a colleague of his tried to actually pull one up, just out of curiosity to actually read it, it didn't exist. Like ChatGPT had fabricated what it claimed was a published academic literature story report, but it was not. It just wasn't true. It doesn't exist in that academic medical journal. And so I liked the story because it doesn't shy away from the two sides of the coin, right? Like, there are situations where it is very helpful, but you must put in controls. We've been talking about a lot in our portfolio, and it's more technical than we need to, but you have to get to the point where you're verifying, what are the interim artifacts that the technology is creating. You have to do a third-party validation, even if it's a human, another AI, you need to be checking this. Things that we have built, you can talk about, you typically end up breaking a few things as you're putting new features in. And so it is super powerful, but it's not the same as other software that you're used to. And so there needs to be a whole set of controls put in place. And this story went through kind of both sides of the coin that I thought was useful. So.
Yeah, that's awesome. So, I'm glad you pulled it out for the show. It'll be in the show notes. And it's a great example of helping people to understand how AI works, right? Because I'm noticing even with people who use it all the time, they still don't necessarily understand what it is.
Right.
And sort of and why it hallucinates, right? Because because it mimics us, it's confusing as to whether or not like it is like us, and it's not. It's a prediction engine, and it's tuned to generate results in a certain way. And I was listening to AI and I today at the gym. It was Dan Schipper talking to Reid Hoffman, and they were talking about how, in an effort to make the AIs very aligned with us, what has happened that is negative in trying to optimize for alignment is that these things are sycophantic, right? And the being sycophantic means that they don't always want to disappoint us, and so they'll just say some stuff, right?
Right. If you ask it, is there academic literature to support this? It is incentivized through whatever the systems are to say yes. Whether there are evidence or not is immaterial.
Yeah. And that's, and people will sort of be offended by that. It lies and all these other types of things. And it's really just the challenge that the AI engineers are working with, trying to make sure this thing is aligned and doesn't break off. Because, the minute you start to get it to where it's like fully focused on objective truth and it has independence there, you've opened a very different door, right? You've opened a door into, you think you know what's right, but I know better than you do, right? You know what I mean? Like, and so as much as we're mad about the sycophant behavior that the AI comes with, you can think about the other side too, which would be quite disturbing if you were to experience that. So I just think these articles are helpful to lay out the different use cases where AI is like super helpful and where it's kind of challenging, and hopefully more and more people read this with the insight of what this thing really is, which is a token reading prediction engine. Two final stories. CES, Nvidia unveils faster AI chips sooner than expected. CEO Jensen Huang says more powerful chips will enable training of models in simulated environments. It didn't necessarily boost the stock price, but they are ahead of schedule, and they are continuing to roll out the next generation of AI chips. We didn't talk about it because we were off, but while we were away, Nvidia acquired Grok, which is an inference AI chip company. And so Nvidia is very, very active, doing a lot of stuff and continuing to try to maintain their corner of the market.
Yeah, no question. The new chip, should we call it a chip? It's pretty decent size, but Rubin is what its name is. It is significant step function, more powerful and cheaper to run than Blackwell, which is 2025's chip. That was also a step function better than the one before. They've been the market leader in training, which Rubin is certainly geared for forever. And although there are Intel and AMD and everyone is Amazon, Google, everyone's coming out with new chips, it's a long time to catch up to Nvidia on the training side. I don't anticipate them being caught. I mean, they're sold out of inventory forever. So the Grok thing was more interesting to me because I think the number of tokens that are used right now, it's a lot of training spend, but eventually we're going to get where most of the use cases from a market base are inference. As we start having people using it more and more and agents out there, I think inference is going to be a bigger market 5 years from now. And instead of sitting back, they're very aggressive. They bought the leader for I think it was like $20 billion. It was a lot of money, which I think was really smart. And so now they have the market leading by far on the training side, and then they just have actually it's a license to get away from the FTC complications like we've seen out there. But it's basically an acquisition of all the talent and sort of control on the inference side. And so it's brilliant. I am considering buying the stock, even though it's expensive, because that was a really smart play. And so I don't know the stock, but that was smart.
I mean, to your point, it seems like as high up as they are, all signs point to more and more and more and more and more demand for the very foreseeable future. It's hard to see something that like upends this, and so it's like maybe everything is not priced in, especially if they do smart things like the Grok purchase, right? And they kind of start to horizontally, cover the entire stack. So it's an amazing company. All right, final story. This is a fun one. Out of CES, Lego Smart Play, hands-on, using smart brick technology to get kids to play together. So basically, Lego has now gone AI. When you buy a box of these smart brick Legos, they've got a chip in them now. And, they can kind of do things intelligently based on which bricks you put near other bricks or which bricks you stack on bricks. That's fun. I mean, I'm probably going to buy a box of these smart plays one day.
Yeah, it's cool. I mean, I want to test it out. It has like in the it's a regular size brick. Everyone knows the size of the brick. They're tiny. It has an accelerometer, color sensors, and a speaker, as well as a little chip to bring it all together intelligence-wise. So what they were showing off at CES is when you bring another block or like those little Lego people near it, it senses that it's near it, and then it can play sounds or, turn different colors. And it seems pretty fun. I don't know how they're going to use it. Right now it's with the Star Wars branded Legos. So they have like a Darth Vader one that breathes and does the lightsaber. But it's pretty cool. So I agree.
So look, we are kicking off the new year. It's been just 7 days as of the recording. This will come out probably on Friday, but just 7 days as of the recording, and clearly we're moving into an entirely different phase of the world, right? I mean, we're going to keep talking about healthcare, but you cannot ignore what is happening geopolitically and the transformative nature that AI could have on our civilization, and just sort of the very sort of shredded fabric of, I wouldn't just say the American nation state, but I would say there's many nation states right now that are kind of, challenged around the world. I saw an interesting moment that was happening, I think, in Senate in Japan, where the prime minister was being questioned as to whether or not Japan is an independent country or a colony of the United States. And so, we're just in such an interesting time. And I just wanted to say that I really appreciate being able to spend this hour and a half with you every week and sort of working through all these stories and trying to make sense of it, because it really helps me to ground in how much change is actually happening and talk about it with someone who, I respect the way that they think about things. So appreciate it.
Same. I mean, there's so much news that is flying at all of us every day. It's really helpful to process it, and hopefully for our listeners to process it with us. And send us comments or questions or what you want to talk about more. But I find it helpful to think through these things, because it affects where I invest, and it affects how I navigate my day and what I tell my sons about life, which is, gosh, I don't know. And so anyway, yes, excited to continue this year. As you mentioned, we have a lot unannounced yet, but it's going to be a fun year at Jumpstart, and the world's changing. I'm choosing to see that as an opportunity, because otherwise I'll just not get out of bed in the morning.
Yeah, I mean, listen, we are fortunate, right? We're entrepreneurs, and so we get to wake up every day and work on problems of our own choosing, right? You know what I mean? Right. And build things. And I think that kind of agency is such a salve for a moment like this, when I think a lot of people feel like they've lost control, when they've lost agency, when they've lost their sense of where they are in the world, right? Whether it's professionally, or it's their relationship with their country, or their relationship with their party. There's just so many like existential kind of things going on.
Yeah.
And it's interesting how the thing that used to feel the most risky, entrepreneurship, is actually like so incredibly empowering in a moment like this, right? And so personally, that's one of the messages I want to try to get out there throughout this year, is just try to encourage people to really learn more about entrepreneurship. And you don't have to be a full-blown entrepreneur, but like try to live more in a more entrepreneurial way. Because I think that's good. The world that we're in right now is going to really favor that, you know?
Yeah. Yes, no question. And it's approachable. I mean, the tools and tactics, I mean, we talk about them here, but there's lots of places to learn. And I just think it's the best place to get control over your future.
Agree. With all that said, I will not be back next week, but I will be back pretty much most weeks after that. So you're going to have a guest host next week.
We have a guest. He's done it before, Paul Kappelman. So he's done it 2 or 3 times. It'll be good. And it'll be good to get his point of view. He's more of a private equity focused investor. So it'll be good to have that point of view on things.
Yeah. And very experienced hospital operator.
Yeah. Yeah, and it's the JP Morgan week, so we'll have I'm sure we'll have a bunch of news. I think this week was slow because people are holding back, I think, for next week.
Correct. Next week will be a bonanza. All right, man. Well, look, thanks for pulling together the show, and I look forward to listening to you and Paul next week.